Welcome to the Evolved Caveman podcast. I am Dr. John, the guide for your heroic journey towards greater health, success, and most importantly, happiness. And now, on with the show. Hi, this is Dr. John, and I am thrilled to announce that Jory and I are opening up our retreat in beautiful Costa Rica from September 28th of 2024 to October 5th. Everyone wants fulfilling relationships. The hard part is love is not enough. So many factors can get in the way, preventing ongoing connection, intimacy, and aligned growth. All healthy relationships start within. But when we have unresolved stuff, it can easily interfere with those we are seeking to be closest with. Whether you're in a long-term committed partnership or are single and are looking for love, this retreat will guide you in the heroic journey of healing yourself so that you can be open and available to cultivate the fulfilling relationships you desire and deserve. To find out more, visit joryrose.com/retreats. That's JOREEROSE.com/retreats. Hey, avid listener, this is Dr. John back with the latest episode of the Evolved Caveman podcast, and I am really honored today to have as my guest Steve Peterson. And Steve is a friend of mine that I've known for years, and we have worked with several clients jointly, and his expertise is addiction. Steve, welcome.
Thanks, John. I really appreciate that. To see a friend and a colleague like you has just been amazing. I've known you since I moved to California. So, I'm so happy to be here, so happy to work with you, and always appreciated consulting with you all these years.
Yeah, thank you. And I mean, I was talking to someone about this in terms of referrals, and I don't refer to people that I don't know or don't trust, which means it's a pretty limited group of people that I refer to. And I love the people that I do refer to because I can refer to them with such confidence.
Great. Thank you. I appreciate the confidence in me.
Yeah. And so you're one of that circle. So thank you for being there. So do me a favor, tell me a little bit of your background, how you came to be in this field of addiction.
Absolutely. Thanks. Yeah, I started out in psychology. I was starting to take psychology classes back in Wisconsin at a small extension campus of the University of Wisconsin, and got so interested in behavioral science. This is back in the early 80s. And then transferred to the University of Wisconsin-Madison, which I started taking psychology and social work classes, and kind of like found out that I really wanted to work with people. I was so much more interested in people than things. And then started to think about where I wanted to work. So I thought I'd work in the school systems. So I began a placement at a alternative high school called Malcolm Shabazz High School, which is high school in Madison, where all the kids that got thrown out of public school went into this alternative school in Madison. Well, just about every one of the kids I worked with, John, had addictions. So I thought I better start really learning a lot about addictions, and was so fascinated by substance use disorders and how they manifested. I just had dedicated my whole career to it. And so after I worked with this alternative high school, I started working. My second internship was at the Dean of Students Office at the University of Wisconsin-Madison. So I started to work with all college kids who were having difficulty on campus because of alcohol and drugs. They got kicked out of the dorms, they got into fights. And I think at that point I was hooked. I reflected upon my own family and found out that many of my family members had struggled with addiction, whether it be nicotine addiction, alcohol addiction. It was very prominent in the state of Wisconsin. It's a lot of bars and churches, so the whole social life is connected through drinking and smoking. So I had plenty of family members to start thinking about how they became addicted, and then my patients, usually they were young guys, kind of gave me a good start in the work with substance use disorders.
Yeah, thank you for that. It makes me think of booze and Christ. Everything seems to come back to booze and Christ. Maybe, at least in Wisconsin.
Yeah, so definitely in Wisconsin.
Let's go over some of the different types of addictions, because I think when most people hear addictions, you think drugs and alcohol. But there's a bunch of different addictions if you think of, dopamine and serotonin hits.
Absolutely. Yeah, you can generalize it to all sorts of different, not only addictive substances, but addictive behaviors. So initially, as I mentioned, I started working with alcohol addiction, but quickly I learned that most of my patients who used alcohol also used cannabis, cocaine, Valium, all sorts of different dopaminergic drugs where they were getting through their nucleus accumbens in their brain, the reward pathway, a very powerful dopaminergic hit. So, and at that point, I had thought much about other behaviors, but some of my patients also had issues with what later was called process addictions. So some of my patients use alcohol, also gambled, or also were compulsive around sex. So I although that was not my initial area of study, I started to really think more about how it affected all areas of our behavior. And it's roughly about 10% of the people have some type of addictive disorder, and that it does include process addictions. And then most recently, because I do work with a lot of young guys, it's a lot of addiction to gaming, right? So a lot of my patients have gaming addictions. They're not able to really develop social skills because they're on games, 6 to 10 hours a day.
So what's just to titillate, the listener, what's the weirdest addiction you've heard of or run into?
I have run into people who have addiction to different fetishes, right? So like addictions to certain types of pornography that's quite, intense, right? So
quite dark.
One particular guy I've been working with, he is into viewing porn related to trans, right? And so that's something I really started asking about until recently. And as I'm starting to look at his pattern, his porn addiction is kind of like ramped up to looking at images of trans folks, and he's masturbating to that. So that's something I'm hearing more and more about in regards to addictions.
Yeah, the weirdest one I ever heard of, it was actually in Dopamine Nation, where she talks about a guy that was an engineer who fashioned a machine that it was an electrical stimulation or shock machine that he would wire to his genitals. And he started doing it himself solo and got turned on by that. And then he figured out a way to allow people on the internet to do it for him. And he had a really difficult time getting away from that dopamine hit. And I thought that was fascinating.
Yeah, I've read that book too, Dopamine Nation, and I remember that story. That is definitely a strange one. So many things can be elicit that reinforcement, right? So people get reinforced over time, and it's a conditioned response, and they start predicting that this is something that's going to give them that hit, right? And so whether it be driving fast or gambling in a casino, all these things are subject to compulsive behaviors. So
to what extent do you think thoughts and emotions can be addictive? And in other words, like I can see people like depressed people that get addicted to their own self-pitying thoughts or negative view of the world, or we get really attached to that which is comfortable, like self-pity or feeling depressed
or misery, right? Yeah. I do hear that. I do think that there's a strong relationship there. I have several patients who are very, very depressed or very anxious, and that's part of what gives them a meaning and purpose, right? It's like
sense of identity.
They're really attached to those types of experiences, and it's hard for them to see because of their worldview, because of their narrative, anything but that experience. So,
speaking of worldviews, I got to throw this in. This just excited me this morning. So, as I've been researching more in spirituality and psychedelics, I've gotten more into this idea of animism, right? That all things are embodied with sentience or spirit. And, I can totally get behind that with trees and plants and animals. I had a little bit of a hard time with, rocks and metal and, my AirPods or, that kind of thing. And then today they released a scientific study that showed that metal can heal itself.
That's fascinating.
They stretched it 200 times a second, and it was platinum, and it was in a vacuum. And then they looked at it under electron microscope, and at a nanoparticle level, the metal actually knit itself back together. Now, how do you explain that? Like, I can't, that's so far out of my. Anyway, that was a little tangent.
And I appreciate that because the more we kind of like understand and are humble, the more we can be open to looking at things deeper. Each time I read a new book on addiction or talk to a new client or work with a new program, I learn a little bit more about it. And it's kind of like there's so many things we don't know. And so
one of the things that I've seen with psychedelics is, one of the ways they measure progress or the impact of a journey is with I think it's the mystical questionnaire. I forget the exact name, but it's basically during this experience, to what extent did you have these mystical experiences? Mm-hmm. And the higher they score on that, the better off the outcome for that individual. And it makes me think that one of the huge benefits of animism for me personally is I go through the world with this hugely increased sense of wonder, awe, connection, and almost magic. That's a really good, I like living in that world.
Yeah, it's really a way to embrace open-mindedness, And I've been recently studying this particular therapy for over-control coping, and it's called radically open dialectical behavioral therapy. It's for over-control coping. So the idea is to become open to things that we don't know, open to disconfirming feedback, and really get out of fixed and fatalistic mind and into flexible mind. So I love the idea of animus because it's like, what are the things we don't understand, as opposed to just kind of assuming that I know all about addiction because I've been studying it for 37 years, to be really open to that. All these different questions, we have no idea. And I've seen the field of addiction change so much because we have been more open-minded.
Mm-hmm. Yeah. And I think, one of the things that I see as a hallmark of most mental illnesses is rigid thinking. The lack of flexible thinking, the lack of open-mindedness. And I think that's one of the big benefits of psychedelics is that they do away with that lack of control or that sense of control. So your control, then you have that fear of loss of control. So that kind of dissipates or gets blown up. And then it also by definition, I don't want to say destroys, but does away with rigid thinking because of the cross communication in the brain.
It really opens our thought process up. And as you and I were consulting about a case a couple weeks ago, and I think I recalled the patient who had been in therapy for many months and said he was going to try psychedelics. And I said, okay, well, tell me more about it, because I was being open-minded. And he we lost contact for a couple months. He tried it, and he felt like it really opened up a new realm for him. And so, I'm trying to be open-minded about that particular approach. I've worked with a lot of patients who use psychedelics in an abusive way, but I'm open to looking at it in a therapeutic way. So that's good. And that's one of the conversations you and I had the other day. It's like, how can we use all tools, not be limited?
Well, and I think to that point, I think there's a difference between using psychedelics recreationally versus using them therapeutically. And the big difference to me is, the pre and post sessions. So you have these sessions before the journey where you're prepped for what's going to happen, how to deal with a quote bad trip, all these different ideas. You have the journey. And then after the journey, you have integration sessions to help solidify the gains you've made during the journey. And I think, one of the things the research is showing is the therapy element of psychedelic psychotherapy is massive and can't be understated in that process. So let's go back to addiction. And what are some of the addictions that you deal with most typically?
Yeah, I would say that kind of a typical patient would be a younger guy, maybe 18 to 24, who is sent because of his parents, or sent because of the legal system, or sent because of his school, and so they often come in not very willing, not very open, not very motivated. And so this particular therapy I do, called motivational interviewing, takes a look at where is their level of motivation, where are they at in terms of it. So they really don't see the substance or the behavior as a problem, they see it as a solution, right? So although it's causing some consequences in their life, they look at it as, hey, I can manage this. And so part of the therapeutic process is to explore that. So the person who's coming in drinking, using cannabis, using opiates or other drugs like benzodiazepines, stimulants, is they're saying, hey, this is working for me really well, but they're not necessarily seeing that there's consequences related to it. So part of the idea of therapy is to explore this together. We interview it. We both look at it together, and it's like based on a therapeutic relationship. So when a person comes in, first step is to really gain their trust, establish rapport, and so that we can talk about anything, right? And oftentimes it leads way past talking about a drug or a behavior. It leads into what we were saying before, which is what's really going on with the person inside, their emotions, their thoughts, their self-concept. All those things are relevant in our sessions, and many of them have a comorbid mental health condition, like a post-traumatic stress disorder, like some type of anxiety disorder, or depression, or bipolar. So all those things have to be factored in as I'm doing my initial assessment.
Yeah, and thank you so much for doing that work, because I've done anger management with adolescent males, and they're like, I'm coming in once, I'm not listening to anything he has to say, and then I'm out of there. Mm-hmm. Mm-hmm. And I'm like, I used to be like, oh, okay, send him in, and I'll see if I can, convince them that I'm interesting, or that there's something of worth here to be gleaned. Right. And it's tough work. And so how do you convince someone? What do you do when someone weed comes to mind with adolescent males, right? Like, I'm smoking daily. My grades have kind of tanked. My motivation's down. I'm not really interacting with anyone besides weed smokers. How do you convince them that change might be a nice possibility?
Yeah, I think really it's getting to know the person, getting to know their valued goals, getting to know how the drug use, for example, with cannabis, is affecting their valued goals. So, and then you're trying to elicit what's called change talk. So there's change talk, which is, hey, this is more of a problem than I thought. And there's sustained talk, which is, hey, this is working for me really well. So you're exploring that with the client, right? You're through the therapeutic relationship, you're looking at how is this really affecting them. And usually they come in and they're like, I have no problem. Mm-hmm. And within five or 10 sessions, they're like, this is more of a problem than I thought. Well, they may not change for 4 years, but mm-hmm. you're planting some seeds of what's called discrepancy, right? So this discrepancy between what I am doing and what I want to happen. So you're building discrepancy, it's called. And you do that through asking open questions and doing lots and lots of support, right? People are coming in often feel kind of ashamed about themselves. I was working with a college kid yesterday and got kicked out of the dorms for selling cocaine, and he felt horrible about himself, right? So you have to look at the emotional part of it. Many of these people are hurting inside, so you're looking at the deeper emotional experience.
Yeah, one of the things I used to get from adolescent males who are smoking a lot of weed was I would ask them what their goals are.
Yeah.
And the commonplace answer was, I want to be a rapper, or I want to be a social media influencer.
Yes.
So the weed was actually helpful to their goal. It just wasn't helpful in moving towards those goals.
Right. Yeah, it would kind of fit the persona of those of those two senses of self, right? So and John, quite honestly, many people, especially younger people, they're not going to change. So it's kind of unrealistic to think that when you send a person to treatment, they're going to change right away. So it's not a change event; it's a change process. So you're part of the change process, and there might be 5 therapists in that process, and it's okay. You're planting the seeds. You're establishing that help seeking is a positive thing, right? So you're not trying to punish help seeking. You're trying to reinforce it. It's like, mm-hmm. Hey, it's great to see what's been going on in your life. I let them bring up the substance use. I usually don't start with that. I'll say, yeah, I'm Steve. I'm here to I want to learn more about you, right? So I come at it from more of a humanistic point of view, as opposed to hey, I'm a drug counselor trying to take something away from you.
Are you familiar with that? I can't find it. I was just looking for it on my computer, but that it's a poem about the stages of change and the hole in the sidewalk.
Yeah, I know which poem you're talking about. I can't necessarily quote it, but the whole concept of that is, I keep, walking down the street and falling in this hole. Well, eventually I'm able to look at the hole and avoid it. And that can take, months and years for that to happen.
Yeah. Yeah. And then eventually, I think the last one is then I walk down a different street.
Then I walk down a different street, right? Not only do I avoid it, but I walk down a completely different street, which is metaphorical, right? So we have choices. And sometimes we don't really see that we have choices. People are kind of locked in. This is the only way to do it. That's like fixed mind.
So one of the questions I get, which I want to hear your response to, is let's say I've got a family member that is drinking too much. How can I get my wife, son, daughter, father to come in and see you and stop drinking?
Yeah, there is a process known as it's called CRAFT, the Community Reinforcement and Family Training Models, the CRAFT model. There's quite a bit of data around that was a pretty effective approach. So, I think the initial step is to talk with that individual when they're not drinking or using, right? So you want to pick out a time of day where they're not high or drunk, and really, as opposed to a punishment, it's like I'm sharing concerns. So a lot of treatment, especially early in my career, was kind of like based on the punishment model. Mm-hmm. That was very ineffective. So the community reinforcement and family training model is really all about trying to look at the benefits of change, right? And getting a person kind of interested in it. Punishment model doesn't work. Locking people up doesn't work. But positive reinforcement seems to work pretty well. So there is a treatment center in New York City called the Center for Motivation and Change, right? So they wrote this book. It's called Beyond Addiction, and it really talks about this community reinforcement model. So you're trying to help your family member take a look at this, but not in a punishing way, but in a way that's going to help them look at the concerns that they have. One of the change talk behaviors I was saying before is, what I'm doing is really affecting my significant other, right? And the person doesn't necessarily see that at the beginning, but as the family members share this, it kind of raises the awareness that this is more of a problem than they thought.
Yeah, I think that's a great question. How much is it affecting the relationships around you? And then the other ones I like are how much time do you spend thinking about your next drink, your next fix, your next hit? Right. How much time do you spend pursuing that?
Yep. Yeah.
And that's when I see that's pretty prominent, where people that are addicted, the thought of their substance of choice dominates their internal world.
It's all they think about, and I see that. I mentioned I'm from Wisconsin. Well, when I was growing up, there was probably 50% of the people smoked, right? And you saw each behavior, each thought was trying to facilitate the next time they could go have a smoke break, whether it be driving in the car, talking on the phone. So it does take a lot of RAM, right? In the brain, this is what I'm trying to do. And I look at family members and they're kind of living to smoke cigarettes. And that is one of the hallmarks of addiction. That's not a moral issue. It's more of a brain chemistry issue, a brain, structure issue. So we've kind of gone from looking at addiction kind of in a moralistic way to looking at more in terms of scientific, like a brain disease.
To what extent do you look at it as, and I know this is oversimplifying, but to what extent do you look at addiction as the mindless use of a substance? So in other words, you're not being mindful at all. You're just automatically and habitually reaching for that drink at 5 o'clock without thinking. It's
classic conditioning, right? I'm not even thinking about it. It's automatic behavior. I'm not taking a step back saying, this is harming me, right? So they've been doing it for their whole life. And it does take some type of consequence or difficulty before a person goes from, you're talking about the change process, right? The change stages of change. Before a person goes from like pre-contemplative to action, they have to have a number of different experiences where they start to say, I can't keep doing what I'm doing, right? This is not working for me. And I see this every day, right? And my job is to like pay attention to it and get them out of that automatic thinking.
What are your thoughts on habit substitution? I've heard varying things. Habit substitution, like I just read this morning, that if you bite your nails or chew your fingers one of the things you can substitute for that is rubbing two fingers together. Or if you're if you're drinking beer, if you're addicted to beer, you can swap out, non-alcoholic beer for the beer.
It's definitely, John, one of our strategies, right? Is you want to substitute a more negative behavior for a more positive behavior, right? Mm-hmm. So you can do it like you're saying, kind of alcoholic beer to non-alcoholic beer. That's definitely is a helpful strategy. Most people are not going to go from drinking a 12-pack a day to not drinking, right? There's a process of that. So choosing a less harmful behavior is a good one. And what I try to do is try to figure out and sort through what is a positive behavior, right? So there's a less harmful behavior, but there's also like what's a more positive behavior. So for example, people who are this is why our mindfulness strategies work really well. It's like, okay, I'm doing something that's harming me, like a substance use disorder. Well, now I have the ability to mindfully look inside myself, right? Work with relaxing my body, right? We call it a sober breathing space, where a person's able to reflect upon what's going on, breathe into it, and look at expanding their choices, right? So we're trying to change out the negative behaviors for the hopefully positive behaviors.
Can you give me some examples of that?
Yeah, a guy I'm working with, I think I mentioned him a couple minutes ago, the college student who got kicked out of his dorm for selling coke. What we're trying to help him with is starting a mindfulness program, starting a yoga program, starting a program where he, on a regular basis, is with peers, right? So the social isolation and substance use is a pretty big problem, right? So how can I connect with other more positive people?
Okay, great. And what are your thoughts on drug substitution? Where let's say I'm drinking and I'm going to stop drinking and then I start smoking weed.
Yeah, and that's a common. I think that's a very common thing, right? So it's we call it a cross addiction, right? A person can. It's not really recovery, right? It's just substituting the problem. So it happens every day, right? So a person might say, "I'm not going to be drinking whiskey. I'll drink beer," right? I'm not going to drink beer. I'll smoke weed. So they're trying to change to a less harmful behavior. So one of the newer models in probably the last 25 years is called harm reduction. So a person, for example, we have a big opiate crisis, lots of overdoses. That's a very bad thing. So people will for their pain, whether it be psychological or physical, stop using opiates, which can cause overdoses and deaths, to using cannabis. Well, you could definitely argue that's a less harmful way, because they're not going to be risking overdose. So all those are approaches that we can use. Harm reduction is an approach. Abstinence-based approaches are good too. Regular psychotherapy. All those are things that I think we need to utilize, because we're not having the outcomes that we need to have in addiction treatment.
And when I think of drug substitution, I'm often looking at, because I think emotion drives almost all of our behavior. And I think it's intimately connected with addiction. And there's other aspects in there too, brain chemistry, habit. But I'm always asking people, like, what emotion precedes your urge to pick up a cigarette?
Right.
Like I'm just trying to create more mindfulness there around that. What are some of the factors that you see predispose people to different addictions?
Yeah, I would say
genetics.
Yeah, genetics is a big factor, accounting for maybe 60% of the variability. But emotional deregulation, I think that's a factor. So a person can be feeling anxious, and they through like early exposure find out that if I'm anxious, I can take a drink and that makes it go away. It numbs it off. So I avoid the anxiety with a drug. Well, when you go back and do a chain analysis, you find out that the real emotion is that I'm anxious. Well, there's many ways of handling anxiety. So we take a look at that. Is it social anxiety? Is it anxiety related to making a mistake, like over control coping? Is, kind of like what's driving it? And then we help clarify that, explore that, and then give the client some other options to deal with those feelings, whether it be anxiety or depression or trauma flashbacks. Many of the patients I have, if not all, have some type of traumatic experience, whether it be a parent's, parent conflict, or maybe they were bullied in school. So we're trying to help them take a look at that and give them different ways of managing it.
And I really like, because you said, kind of numbing that emotion, which I think is exactly what we're trying to do with most addictions. And I love Brene Brown's line that we can't selectively numb emotions. So you can't just numb the bad, negative, uncomfortable emotions that you don't like. If you do that, you're also numbing all the positive emotions. And that creates this vicious cycle where life is painful.
Yeah, you're living being numb, and you're right. I might slightly numb my anxiety, but also I'm going to numb my sense of joy, my sense of wonder, which you referred to, as you're looking at the world, right? If you're high or if you're drunk, you're not experiencing all the amazing things out there. A person's smile, a sunrise, a flower, we don't want to numb those, really positive experiences.
Yeah. And I think, one of the things I've thought a lot about is I really think we had life figured out better when we were about the age of 4, 5, 6, because a lot of these pleasures, like sensory pleasures that you go back to that bring us joy, happiness, curiosity, wonder, awe, whatever it is, they're natural, they're relational. Like you said, a sunset, watching the waves, looking at Half Dome in Yosemite, looking at the stars at night, wondering about trees and, how do they communicate? Like, how do they heal? Like, those kind of things bring joy. Learning something new gives us a dopamine or serotonin hit.
Yeah, playing a game. I mean, and I think, sometimes in treatment, it's really not about the psychotherapy. It's about learning to have fun and learning to laugh, right? And I've known a lot of treatment centers who just, what they do best is just getting people out there to experience life, right? An outdoor experience, whereas, many times people are using indoors because they're trying to be in a controlled environment. So I love the idea of a 4 or 5-year-old who is looking at the world with such joy and wonder and just experiencing all there is to offer.
Yeah. And it really makes me think that, I think when I was 12, let's say, I was pretty convinced that I was the only male that felt things deeply. And come to find out, 95% of the men that I've worked with over 20, 30 years are exactly the same way. We're all just putting the mask on to kind of hide that. And it makes me think that the vast majority of us feel things deeply, and it's painful at times. And so we're looking for ways to mask that. And I think you're absolutely right that, one of the parts of the solution is learning how to turn down the volume or manage or sit with uncomfortable emotions. And then the other side of the equation is, how can I become more aware of the positive emotions? How can I put conditions into my life where I can cultivate them more frequently? Because I really think that most people don't even recognize or aren't even aware of a positive emotion when it hits them in the face, because positive emotions are fleeting, fragile, quiet. They whisper to us. And the other kind of addendum to this is there was research that came out a few years ago that showed that, to your point of laughing and smiling, our sense of humor jumps off a cliff around the age of 23. Well, what happens at 23, but we go into the workforce? And then we got to be, serious adults. And then we don't ever smile. Right. And then life begins to suck more. And so I'm often telling the men I work with, look, just be quick and easy to laugh and smile. Yeah. Relax. Don't take yourself so seriously. Right. It's just life. It's a fucking game. Treat it as a game. Cultivate play, cultivate enjoyment, right? One of the things that I do, because self-care for a therapist is super important, is I go on a hike every weekend, right? It's like, I'm going to get out there and just enjoy the outdoors. And for me, it's like, it's playful.
So I'm noticing the birds, I'm noticing, the trail, I'm feeling my heartbeat, and experience that. And I get a chance for an hour and a half every Saturday to kind of like experience play. Right. And then I come back and my mood is great and I'm ready for the rest of my weekend. But I needed to do that, because we've kind of, you're right, we've kind of lost that ability to just have fun.
Mm-hmm. Well, think about how many grown men would you describe as silly? Or even having the ability to be silly at times.
Right. You're right. Yeah. It's all too rare, right?
Yeah.
To do that. And I teach a class every Tuesday in the city on this radically open dialectical behavioral therapy for over control coping. And those individuals in that group are very serious, right? Because they have what's called maladaptive perfectionism. And so part of the group is to have fun, is to be silly, to do things, where we're breaking down our over control coping patterns and just really to have fun. So, and laugh at ourselves. And I love what you said about we take ourselves way too seriously. I think that's especially I think for professionals, like, why are we trying so hard? And I think I've learned how to not put into fifth gear, right? It's like, hey, third gear is fine for today, and just enjoy my time with my patients and my colleagues.
Yeah. Yeah. And I think, what you mentioned, self-care, one of the things I do for self-care is I go see live stand-up comedy as frequently as I can, because not only do I laugh my ass off, which I think is therapeutic and healing and rejuvenating, but also there's something about the aha when you get a joke that I think is beneficial for our mind or our brain, that it's out of the box thinking.
Right.
And so it's fun to play with words and concepts and ideas.
Yeah.
And I really respect people that can be witty, not sarcastic, but witty.
Right. Yeah.
Because it requires so much cognitive load. Like you have to be able to be aware of what's the situation. How can I twist the situation to make it absurd or exaggerated or funny in some way? Can I say that then and not offend people around me?
Right.
And all that has to be done in maybe a third of a second.
Yeah, and how much joy that brings, watching comedy, whether it be a funny movie or stand up, or I like funny podcasts, and I just laugh at them. I was looking at a Saturday Night Live a podcast this morning with Adam Sandler, and I was laughing, right? Getting ready and shaving and getting ready for the day. I was like watching this funny podcast with Adam Sandler singing, and it brought a lot of joy. And these, you're right, John, these comedians are geniuses. They're high in trade openness, and they look at things really differently than me. And I have a lot of respect. And I wish I was wittier, right? But I am able to get that from these experiences.
But, part of it is it's a practice to be funnier, to be wittier, to be sillier. And so now in my life, I'm surrounded by my fiance and 3 teenage girls. And, I do a lot of dad jokes. I make a lot of attempts at jokes. I say attempts because not all of them are funny. And, sometimes you make a joke and even immediately after you say, you're like, oh shit, that wasn't funny.
That was not funny. Right? Yeah.
And I'll tell them, I'll say, look, I'm going to say some jokes that just aren't funny. And you're going to groan and you're going to give me a rash of shit and realize that I'm going to keep making the attempt because there's nothing more important to me than making all of us smile and laugh. And so, to the extent that you can encourage me at times, that's helpful if you want to smile and laugh.
Yeah, I can see how playful that must be, John. I can just imagine, kind of like the playful nature of those people whom you love and care about right there, and just, telling jokes. Some of them land, some of them don't, and then that you mentioned relational, right? Is we don't want to numb the relational experience of joy and love, and humor is definitely one of those things that binds us together. Just like music and art, and movies, like gives us something to look at, talk about, and experience. And I think that's a good thing. And so I can imagine them saying something like, "Hey, Dad, keep your day job."
Oh yeah. I would just get. But some of the things were really funny. I remember we were at Disneyland and we were in the Haunted Mansion, and you know how that first room, there's a bunch of people in it, and then it sinks like an elevator, and the pictures get taller, and then it goes all dark.
Been there.
It went all dark, and I had a bug up my ass. And so I was making this really funny noise at the time. I was like, ooh, and I said it super loud during, when it's pitch black. And I think everyone thought it was part of the ride, and it scared people. And we were just giggling our ass off because the girls knew exactly who was doing it.
Yeah. Dad did this.
Yeah. Just stupid stuff like that.
That is precious. Right. Yeah.
And it's a shared memory. It's a shared experience.
Mm-hmm. Well, I was just thinking about, one of our main strategies in treatment, it's called go opposite, which is like, if I'm serious and if I am using to numb my feelings, I'm going to go opposite and do something that's fun and enjoyable. And one of the reasons I so love working with you is you kind of bring this positive psychology approach to all your work and social work kind of in the last 30 years kind of moved from a very pathological model to a strength-based model. And so one of the things I so enjoy, and you highlighted that so well, which is, hey, what are your strengths, right? And you mentioned kind of like, how do you work with kids? Well, a lot of it is especially initially, hey, what are your strengths? So I had a kid in here yesterday, he loved cars. He loved music. We had long conversations about kind of like what his goals were and some of his interests. So I use a strength-based approach, and it works so well. It's like why would we pathologize when we can build strengths? And I think that's another reason I don't get burned out is that it's like, hey, I get a chance to build some strengths today.
Yeah, and I love that approach, the strengths-based approach. To what extent do you think, or do you see a theme among your clients where they are over-identifying with the thinker or that rational side or that analytical side of self and cut off from the emotional side or have suppressed that emotional side?
Yeah, they're stuffing their feelings, they're avoiding their feelings. Yeah. They want to not deal with it, especially the shame, the self-conscious emotion, shame, guilt, right? And the thing with addiction is embarrassment. Yeah. So
men do not like to be embarrassed, I've found.
Oh my gosh, that's like the worst thing ever, right? So it's like, you want to do that. So we, I'll just start using these words that they're not familiar with, like, hey, shame and guilt and embarrassment. And initially it's like, whoa, I'm not going to go there. I'm not going to talk to you about that stuff. But as we engage and there's a trust, we get a chance to really look at those self-conscious emotions and explore them together. Hey, they're not so scary. There's no need to push them back, and that's where sometimes self-disclosure can be helpful, right? So self-disclosure is I was taught initially, just about no self-disclosure, right?
Mm-hmm. That's how we were all trained. I threw that out the window. I threw that out the window years ago.
You don't share much about yourself, right? That was kind of like the approach. Yeah. And then kind of it went to, you can share about yourself if it pertains to the client, right? If it pertains to the patient, which I think I definitely buy, and that's what I teach in my ethics class. And then I think we can go a little bit further in that, some of the stories, some of the experiences, especially of self-conscious emotion, models for the patient that, hey, we've had experiences that were difficult too, right? Not that the session is about me, by no means, but, we get a chance to say, yeah, I remember a time where I was feeling pretty ashamed too, right? And you pick out something that's not, like the most ashamed time you've ever been, but something that the client can grasp, like, wow, even Steve has felt guilty or ashamed or have self-conscious emotion. And it gives permission for the young man or a guy in general to be able to share more.
Yeah, no, I absolutely agree with what you're saying. And so just to cover quickly, guilt, shame, and embarrassment, if we can, for those people that aren't familiar.
Yeah. So when I'm feeling guilty, I violated something that is a rule or a value, right? So it's like, okay, one of my rules is, I keep my driver's license, right? And so, a person gets a drunk driving, their driver's license taken away, they feel tremendous guilt, right? They're like, oh my gosh, I've affected my family. I'm upset. I have not been able to adhere to this rule in my brain. So I've done something wrong, right? So shame is different in that it's not that I've done something wrong, but it's that I am wrong. There's something fundamentally flawed with me. Right. So early on, there was a lot of authors like John Bradshaw that talked about, healing the shame that binds you. Yeah, so a lot of our work was taking a look at what is that cognitive mindset around that you are inadequate, and that that's common in just about every one of my patients, right? That something is wrong with me fundamentally. So shame is that I am wrong, and then embarrassment is that feeling that I've done something that is kind of like out of the norm. Maybe it's not something I'm tremendously guilty about, but it's like I burped in public, right? It's like, oh God, I did something that people are paying attention to. So it's a self-conscious emotion in a community that people feel kind of upset about, and again that blushing of the face is a part of that embarrassment, right? Mm-hmm. And it kind of like notifies us that we're feeling embarrassed. So that's how I see it. I don't know if maybe from a positive psychologist point of view, you maybe have more to add to that.
No, I think you're right on point. I think I look at guilt as I am bad. Shame is I am bad. Guilt is I did bad. I did something wrong. Shame is I'm unworthy of love, belonging, and connection. Mm-hmm. So shame is deadly. Like it's like a queen or a king emotion. It can out volume anything else. It's louder than any other emotion. Yeah. But it's rarely, if ever, telling us the truth. Mm-hmm. And so it's a really deadly emotion in that regard. And if you would have asked me 5 years ago if I had ever felt shame, I would have been like, no, I don't really have any shame right now. Mm-hmm. And then I saw it. And it usually would occur in a disagreement with Jory, my fiance, where, I would get flooded after 15, 20 minutes. I try not to say anything in anger, so I'm shutting down. Mm-hmm. And if I would get flooded, I could go sometimes to this place where I would hear the thoughts like, oh, she'd be better off without me, or I'm no good at this relationship thing. Mm-hmm. And in hindsight, looking back on that, I was like, oh shit, like that's shame. Yeah, that's a belief I'm not worthy of being in this relationship. Right. Or relationship at all. Yeah.
It's not just this relationship, but it's all relationships. And you're 100% right that a lot of the presupposition is I am unworthy. I'm not worthy of love. I'm not worthy of taking care of myself. And so, a big, kind of subject for sessions is the self-care, right? How can you look at yourself as a worthy person? How can you treat yourself as a worthy person? And as I'm treating myself better, then I'm more open to getting in better relationships. So, but it takes a while for us to get there, because men can be pretty well guarded related to feelings of worthlessness. But that's a lot of treatment. So kind of in summary, in regards to the substance use, people are using drugs, using behaviors, absolutely. But we don't talk very much about drugs and alcohol, right? So I'm a drug and alcohol counselor who doesn't talk about drugs and alcohol. It talks really about what's going on with you, what's happening with you, and they're already judging themselves pretty harshly, and others are judging them. So we got to get at the roots of the problem. We're not. We actually tried psychoeducation with drugs and alcohol. Didn't really move the needle, right? Didn't really move change. What really moved change was looking at the underlying personality structure, the kind of how I felt about myself, and then looking at taking care of yourself and valuing yourself. Way better outcomes when we shifted away from psychoeducation and into more like interpersonal development, skills building, feeling identity development, who am I really, right? So that's kind of the approach.
Yeah, thank you for that. And I think, also one of the things that I think helps in this area, and maybe it's just happiness in general, is having those self-transcendent values or goals or mission. So something bigger than self, because I think so many of us can over-focus on ourselves, depression, anxiety, those are extremely self-referential mental illnesses. And, to the extent that we can get out of our own head and focus on others and serving others, for example, I think that's a really good way to go.
Yeah, the purpose, right? I have a meaning and purpose, right? So and we haven't really touched on that yet, that when a person has a meaning and purpose outside themselves, right? That's so helpful. And we do get tied up in self-referential pronouns like me, my, I, right? And that kind of like pumps up the ego. And when we're serving others, we're helping others, we feel like we're contributing to the benefit of our community, of our family, of our society. That's where I think real positive sense of self comes from, not from look at what I've accomplished, right?
Yeah.
That's only superficial. There's a lot bigger, lot more to do there.
Yeah, I think one of the things that my parents drilled into me as a kid is this idea of leave the world a better place.
Mm-hmm.
And it's the same idea, right? It's support other people, support your community, support the elderly, support kids, serve other people. How can you make this world a less painful, more tolerable, happier place?
Mm-hmm. Yeah, it's voluntary sacrifice for the greater good, right? So I'm not doing something because I have to. I'm doing something because I want to, and I'm making that sacrifice for my family, for my team, right? My team at these treatment centers I work at. I'm like, okay, I'll take your call, right? Because I want to help you and I want to consult with you. I want to share my thoughts about this patient or situation. And by helping others, I feel better about myself.
I thought you were going to say something about my tribe, like I need to support my tribe. And you didn't go there. But in my mind, I was thinking, yes, and my tribe is humanity.
Yeah.
I think we need to expand our definition of our in-group to humanity.
Right.
I think that would help out with a lot of the division we see in the world these days.
It's a much bigger context, right? Kind of like, as opposed to my tribe being, my family or
Republicans or Democrats or Californians.
All that divided sense, right? We have way more in common than we have rather than differences. So it's like, what are our shared commonalities and what are our shared goals? How can we help? I do try to do some work, in the community. There's several groups like Kids Against Hunger that I try to help with, where we pack meals for other countries. And goodness, that's something that's really positive. And it's looking at the world in general as opposed to just ourselves. So I do love that idea of purpose and meaning, and I think it helps with recovery. It helps with psychological health.
Well, thank you so much for sharing your wisdom. I really appreciate it. And where can people get a hold of you if they want to find out more about Steve Peterson?
Yeah, so I have a practice in Pleasanton, California. I can share my phone number. I don't know if people do that in this situation. So 925-819-6775. So that's my practice number in Pleasanton. I also work at the Caveman Center, which is a dual diagnosis program in San Francisco. And I teach at Diablo Valley College, and we have an addiction studies program there. I teach courses in group therapy and ethics at Diablo Valley College. So those are my three areas those are my three jobs. And, mostly it's substance abuse, maybe 70%, but I work with people that have other mental health issues too. And I also work with first responders. That's something I've been doing a long time. I have a number of patients who are police officers and firefighters. So I really love that work, John. So, yeah. And I just want to say, I really appreciate, all the work you do in the community. And I know that your focus on anger, is so great. And I've referred patients to you to work on their emotions, such as anger. And I often give patients your book, and the book that you wrote years ago, patients really benefit from that. So I appreciate you, allowing me to give that to patients.
Well, I greatly appreciate the work you do, because I don't want to do it. So thank you for the work you do. I think it works out well that way.
Yeah, we have a great reciprocal relationship.
Yes. So thank you for being on the podcast. I appreciate it. And that is it for this episode of The Evolved Caveman. If you like this episode, please be sure to like, rate, review, and share. And if you didn't like it, you don't have to do a damn thing. Until next time, this is Dr. John.
Thank you for listening to the Evolved Caveman podcast. If you like what you've heard, support us by subscribing, leaving reviews, and sharing the podcast with friends and colleagues. For the latest, most powerful tools to connect with like-minded men, join the Facebook group at The Evolved Caveman. Follow Dr. John on Instagram at The Evolved Caveman, all one word, or join the email list by visiting guidetoself.com.